Hi there. Thank you for joining us once again. I'm Dr. Mahendra Carpen, Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. This program is called Your Doctor in COVID. And remember, if you have any questions or comments, feel free to send us a WhatsApp message to 620-6275 or shoot us an email at doconcovid@gmail.com. Today we continue our conversations with an expert in the field of COVID-19 management, particularly in the Guyana context, Dr. Shazima Shah, who has been at the forefront of all medical development related to management of COVID-19 in Guyana. Welcome again, Dr. Shah, as we continue our conversations.
Thanks, Dr. Carpen.
So, I know that you would have dealt with a number of sick persons admitted to the COVID ICU at the Georgetown Hospital. I believe we had over 250 admissions, and an unfortunate number of 104 persons would have died in Georgetown Hospital. About 60 odd of those persons would have died in the COVID ICU. What has been your experience, and how do you cope with the death of a patient, particularly one who would have spent some time that you actually got to know them?
It's always hard losing a patient, particularly the ones that would have spent a long time, as you would have mentioned. So losing patients, not just for me, but for the entire team, sometimes it's an emotional roller coaster for these individuals. So we would always sit to try to go around what could have been done better or anything to that nature. But it's always hard to accept that you lose a patient, there's nothing else we can do, and it hurts. Just as if we're losing a family member, someone that we know.
Yeah, I could imagine that's, always a sinking feeling when you see a patient, you know you're doing your best, but you're seeing them going downhill.
Yeah, and it's hard for the patients because they kind of see the other patients probably going downhill too, and they see themselves going in that same direction. So emotionally, it's very difficult for the patients.
So how do you deal with those persons, those other patients who are watching their co-patients, so to speak, dying or getting worse? How do you comfort those who are looking on, those patients?
We try to talk to them and tell them, hey, this is why it's important for you to keep your mask on and to try with your 2 hours of CPAP to just try to get a bit better and to pass this period. We'll support you throughout that. But mental health plays a part there too, because they would come up and counsel them if it's via phone or actually physically being in the unit, depending on the need of the patient. But they play a part in counseling our patients as well.
Okay, well, it's great to have such a reliable and helpful team in place. And dealing with families of persons who are admitted, who are not doing well, who have been told that they're COVID-19 positive, family probably doubtful. How do you actually deal with families in those circumstances, in those situations?
It's hard because most people tend to be angry, and it's them dealing with everything that's happening too. So we try to understand where the patient is coming from, where the relatives rather are coming from. Some people are in denial. They say, hey, it's not COVID, they didn't get COVID, nobody else is sick. So we always have that to deal with. But particularly, we deal with a lot of trying to comfort the relatives, trying to answer any questions they might have. Some relatives we spend an hour on the phone with, just trying to answer all their questions, to try to address that as much as possible. We update our relatives once every day. So the relative either calls in or we call them directly. Most of our patients that would have spent some time in the ICU, their relatives have our direct numbers. So there is a relationship there where they call and they're being updated regularly.
You mean your direct cell phone numbers?
Correct.
Oh, well, that's going beyond the call of duty.
It is.
Okay. And how does the team actually protect themselves from becoming, apart from their personal protective equipment, how do you protect yourself from all that is involved physically and mentally in dealing with patients?
It's hard. It's hard so physically we try to keep our masks on, try to sanitize, social distance from each other. So you come out of a unit spending 4 hours in full PPE, and you still have to wear your mask on the outside because you're interacting with a room of people as well.
Right.
So physically it's hard because we try to stay away. When we're eating in the opposite directions of each other, etc. Mentally, it's all about trying to be composed as possible and trying to see that we are moving forward. It was a bit chaotic initially, but I think we've made so much changes and so much good progress that it kind of gives us hope that things will get a bit better.
Good. Do you think that healthcare workers need counseling or mental health support to deal with COVID-19?
For sure. Our healthcare workers, they do need some amount of reassurance, some amount of counseling. It's not easy to be dealing with this every day for months, and it's the same group of people as well. So definitely they need counseling, and for the ones that are positive, unfortunately they need the most amount of counseling at that point.
Yeah. Why would that be so? Because they would have seen bad outcomes?
They get really scared. They know what the bad outcomes are. We have healthcare workers with comorbidities as well, so they know that the prognosis is pretty poor with these patients. So it's horrible. We've had patients, colleagues, that tested positive and ended up with like cardiac complications after, and they had no comorbidities before. And they're young, healthy individuals prior. So it is scary, and it's scary for all of us that that can happen to anyone.
Yeah. You've been there from the beginning, from the time patients started being admitted to the COVID ICU at the Georgetown Hospital and stuff, and you're there until now. Have you noticed any trends in terms of the number of infections, admissions, persons needing ventilation getting worse? Have you noticed any trends? Is it getting better, worse, same?
That was fluctuating a bit. In July, we did peak to the highest. I think we've peaked with ICU admissions and positive cases that we've seen in the hospital. Following that July peak, we had a peak in death in like September, October. It was the months with the most recorded deaths. And that has been fluctuating, and it continues to fluctuate. Right now, we're on a low spiral, and I think it's probably because of all the implementations with trying to have things in order with respect to social distancing, etc. But the Christmas holiday kind of worries me.
Yeah. You think we'll see a surge after the Christmas holidays?
We might, because people are going to slack up. People are already shopping in town. It's like super filled. No one's wearing their masks, etc. The stores are requiring you to wear them before you enter, but then on the road it's totally havoc. So yeah, the Christmas holidays, people going out, visiting, etc. Let's see what happens after.
Yeah. Well, you were seeing the sickest of the lot by being in the COVID ICU, and we have the Christmas season coming up. You know, people like to party, they like to go to bars, and you leave hospital late at night and you're driving home. You have to pass some of those establishments. What are you seeing that worries you?
The seawalls. They're always packed. The bars, they're filled with people there. I mean, you're having a drink with your friend, you're not wearing a mask. So it's worrisome. The thing is, people don't know how bad COVID is until they're affected by it or a family member is. And that's a really high price to pay to actually learn of something. So just take your precautions before someone else gets ill.
Yeah. So a lot of our population actually have underlying or comorbid conditions and they don't know.
Correct.
And in my field of cardiology, we have about 30% of the persons being admitted to Georgetown Hospital with a heart attack are now finding out for the first time that they're diabetic. And I suspect it's probably similar in the COVID group as well.
It is.
Yeah. What are some of the main comorbid conditions that you see among those admitted to the COVID ICU?
Diabetes for sure is one. And the obese patients, the obese patients do a whole lot worse than the regular patients. But our diabetic population has spiked. We've had lots of diabetic patients. Every time you're reporting a death, diabetes is the comorbid condition that goes there.
What about other comorbid conditions that we see?
We had a few others, but they weren't in large percentages. We've had hypertensive patients. We've had patients with sickle cell disease, some amount of heart condition as well, whether they've had an MI before or they've had some underlying heart disease. But heart disease, diabetes, hypertension, and a few others that are in the smaller numbers.
Yeah. Well, you are a doctor, but you're also a daughter, an aunt, a friend. How do you protect your family and your loved ones, you know, outside of your work? You're a doctor at work, but outside of work, you're not real, you're something else, you're somebody else. How do you protect those around you?
So it's been hard because for the entire year, visits to family have cut down significantly. So my aunts are on the elder side, so instead of visiting them maybe twice monthly, it now goes to every other month maybe. And it's always a visit where it happens in the yard and it doesn't happen in the house. I'm with my mask on, they're with their mask on and stuff like that, because you don't want to be responsible for any breach or anything of that sort. And there's so many asymptomatic persons, you could never be sure. So it's definitely taken a toll on your personal life with respect to just visiting relatives or spending time with your relatives. Even in my household, I have a 3-year-old nephew who's the youngest. And it's hard to tell a 3-year-old, hey, stay away.
Yeah.
So, and I enjoy spending time with him. So it's always that thinking back, taking all the precautions. I don't go into the house unless I shower. So that's like one way of making sure that I take a little precaution there.
Do you ever think that healthcare workers like yourself are paying too high a price while the rest of society is perhaps not as concerned as you are?
I do. And it hurts to know that people don't take the necessary precaution just to hang out. I mean, you need to take the precautions that are there. You need to take all the precautions, wear your masks. I mean, we've been wearing our masks, and it's hard that we try so hard, and we try to do everything that might be correct, and then you can still get a whole lot of patients coming in and you're still at risk with that. So yeah, it is a big price to pay.
Yeah. And where do you see the COVID situation in Guyana heading to?
When COVID started in March to where we are now in December, there have been so much progress with respect to infrastructure, with respect to personnel being trained, more awareness, and various factors that play a major role. And I think we're headed in a good direction, a direction where progress might not be as big or significant as we want, but it's slowly getting there. I think people just need to take the precautions and take this really seriously.
Yeah. So recently in the news, we've had some encouraging developments with vaccines being looked at. Several companies have claimed greater than 95% success rate. And the definition for success, you know, is pretty much the same across the board. Number of vaccinated persons who develop symptoms versus the number of unvaccinated persons who develop symptoms. How do you actually feel about the vaccine and its development for COVID-19?
The vaccine is a big deal. I like the fact that we could all be immunized against COVID-19 and this wouldn't be a problem. I think it's a little early for us to know how effective the vaccines would be, how long it would give us immunity, and that sort of thing. But it's definitely a promising area to look into, and definitely one that can solve our problems.
You think it will be
Let's
something
hope.
that
Fingers crossed.
that's a positive development for the world?
Yes.
Yeah. And do you see the attitude of Guyanese towards getting or taking this vaccine being an issue to mass immunize the population?
Conversations I've had, some people are comfortable with it, some are not. But I think once we start it off, people will follow. If they have favorable results, people will follow. Everybody wants to get back to their normal lives, so
everybody wants. Yeah. Just point some of the claims that taking the vaccine will not reduce the recommendation for wearing masks, social distancing, and hand washing as well. So do you think that will create an issue with persons? It
just might, but I think once they're educated on the importance of the vaccine and why we should take it, we will get somewhere.
Okay. So what's next for you in your medical career? We've talked a lot about COVID, we've talked about patients and families, etc. But for Dr. Shazima Shaw, what's in your career future?
Fellowship in infectious disease, where it would actually benefit Ghana on a larger scale, benefit GPHC, just with implementing an infectious disease program. There's more guidance, it would be better for protocols and guidelines, etc.
For those of our viewers and listeners who don't know what we mean by fellowship, can you just shed some light on that?
No problem. So after you would have specialized in internal medicine infectious disease, you can further specialize just in infectious diseases only. So it's a subspecialty that focuses only on your infectious diseases, and with the pandemic, COVID will be on top of that list.
Yeah. So you spend a minimum of 1 year getting further training, specialized training, just focused on infectious disease.
Correct.
Great. So before we go, is there any special advice or so that you would want to share with our patients or healthcare workers, you being one of the most experienced on the front line?
The healthcare workers, definitely hats off. It's been a good job that are all our healthcare workers. I mean, just taking the risk, doing what we do as healthcare workers, it's been amazing, I think. For patients and just the general population, social distance from others. Use your sanitizers as frequently as you can, and please wear your face mask. It doesn't have to be a sophisticated face mask, but your regular surgical face mask is your regular face mask, the disposable ones, even a cloth mask. Just ensure you wear it. And it's not just wearing the mask, but it's wearing it correctly. So loads of people would wear it under their nose. No, it needs to cover your nose and your mouth, or else it defeats the whole purpose of using one.
Well, thank you very much for joining us today. We've been talking to Dr. Shazima Shaw, infectious disease specialist at the Georgetown Public Hospital Corporation. If you have any questions for us on the program Your Doctor in COVID, feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. Thank you very much once again for joining us for this program, and thanks to Dr. Shaw for sharing with us her wealth of knowledge and experience in this field. Goodbye.